My name is Danica Tyndall, and I am an occupational therapy student. We will continue our educational series on occupational engagement for individuals with dementia through this video. This video will focus on participation in activities of daily living, otherwise known as ADLs. Learning objectives for this video involve understanding changes that occur and best approaches to helping individuals engage in ADLs. Two general tips include grading activities to be easier as individuals progress through their diagnosis and need more support for ADLs. Secondly, avoid the use of adaptive equipment for individuals with dementia who have not previously used the given piece of equipment. Learning how to use adaptive equipment in a later stage of their diagnosis could be difficult. Bathing can be a complex ADL to complete among individuals with dementia. An individual's ability to independently bathe will change as they progress throughout the stages of their diagnosis, from providing standby assist to providing total assistance in the end stages. Try to consider providing privacy for the individual when it is safe to do so. When bathing, the environment must be safe for the individual, as this is an activity prone to slipping and falling. A safe environment can be set up by removing throw rugs, using grab bars, and having a seat and removable shower head available in the bathing space. You can also place a towel on the ground in the bathing space for the individual to stand on. This will help prevent slipping on the slick bathroom floor. Allow the individual to wash themselves and provide cueing for areas they forget. In later stages, you can provide hand over hand or hand under hand assistance, and then eventually perform dependent washing. Be observant during drying and provide assistance, helping to dry in the folds of one's body to prevent skin breakdown. Generally, be sure to consider the individual's cognitive level and being able to set the temperature of the water correctly for bathing. Bathing does not need to occur every day, but should occur in a time frame that is meaningful to the individual while supporting healthy hygiene. Safe toileting requires close attention to the occupation. The individual must manage a safe environment, clothing, safe transfers, and proper hygiene. For safety, ensure the bathroom is set up with grab bars, no rugs, and a raised toilet seat if needed. Safe transfer techniques may be an effective intervention idea for the therapy team and should be practiced with use of grab bars and cues to sit down slowly and carefully. To stand, an individual should make use of grab bars or with one hand on a grab bar and one hand on their walker. As individuals progress through their diagnosis, extra time should be provided for clothing management and perineal care. This may include assistance to identify soiled clothing or briefs, gathering needed supplies, and providing perineal care for thoroughness. Use of briefs for incontinence may be needed. Always encourage individuals to safely complete hand hygiene at the sink following toileting. Nighttime toileting can be made safer with night lights. Generally, timed visits to the bathroom can help reduce accidents. This is a vulnerable occupation, so ensure you inform individuals what you are doing and why to reduce stress and anxiety. Patience is key with the completion of dressing. Individuals may move slowly when dressing, but encourage independent completion if it is safe to do so. Have the individual complete dressing in a seated position for safety and provide supervision for problem solving as confusion arises. The individual may benefit from cueing for where to retrieve clothing from, order of putting clothing on, and adjusting clothing once on. Dressing can be set up for the individual by laying out the clothes in the order they are to be put on to provide a small support. When progressing to dependent dressing, allow the individual to have an autonomous choice between options of their clothing, and then explain how you plan to help them dress before you do so. Loose-fitting and comfortable clothing that are easy to put on and take off are best for ease of dressing with individuals who have dementia. Eating and feeding is essential for individuals to nourish their bodies and stay healthy. Individuals' food preferences may evolve throughout their diagnosis. They should be encouraged to eat a nutritious diet and lots of healthy fluids, but remember that any form of calories is great to keep their body nourished. Individuals may begin to forget social cues of eating, safety concerns related to speed of eating and temperature of food, and struggle with use of utensils. Individuals may forget about the task if food is placed in front of them, so someone may need to sit with them and provide reminders and cues to eat. Many cues may need to be provided related to appropriate bite sizes, wiping mouth during the meal, and chewing or swallowing as necessary. Some individuals benefit from supports such as cutting up the food for them or plate guards for eating. As the disease progresses, finger foods may promote independence for the individual to handle and eat using their hands. Eventually, individuals may benefit from one-on-one assistance during eating in an area away from others and with limited distractions. Collaborate with the speech therapist on site for recommendations related to safety for swallowing and much more. Ultimately, safety is key with this occupation. Grooming and personal hygiene is an occupation that will likely be completed every day. Individuals may require reminders to complete this occupation. Providing individuals with a visual checklist to follow to ensure they do not miss a step of their grooming routine may be helpful. Individuals can perform this occupation while seated at a sink or countertop for safety. Limit distractions during grooming by only putting out needed supplies for the task. When supervising the task, the individual may benefit from cues for the correct amount of product needed or which product to use for tasks. Be sure to allow for extra time for independent completion. As the individual becomes more dependent, allow them to perform smaller tasks such as brushing the front of their hair or washing their face with a wash rag. Additional tips include the use of electric razors or going to the hair salon for an outing. In summary, this video has provided you with information and approaches when engaging in ADLs with individuals with dementia. The use of cues, limiting distractions, grading the activity, and promoting independent problem solving are all useful tips when working with this population.